I'm going to get you into the system first, and then I'm going to have you fill out the medical history and all that other stuff that you always have to do with doctors. Okay, so how do you spell your name? Okay. And your last name? I mean, I know I have it right here, but I figured I'd rather just ask. Okay. So, I have your name on your file, and I need you to fill out the form. Okay, so I'm going to let you do that. Alright, and then I'm going to get everything that I need. I'm kind of short-staffed today, so I'm also doing the reception job and the doctor. Yeah, but, you know, I get somebody in later on today, so it's only, what time is it? It's only 11:18, so I have somebody come in at 3. Okay, so I'm going to have you fill it out. Here's the pen, okay, and I'm going to get everything that I need ready over here. Just let me know whenever you're done, okay? Oh, you're done. Okay, great. Oh, you forgot the back side. That's okay. While you're filling this out, I will just go ahead and put what I have right here, okay? So I'm gonna go ahead and give you that, and I'll keep this copy, okay? Your address is 301 North Street. Must have been a crazy drive all the way up here. Yeah, they're doing construction all the way on the highway. I hate it. Okay. And your date of birth. Oh, I'm sorry. I'll stop asking you questions. For your emergency contact, is that G? Okay, okay. Your insurance. Okay. And I'm actually going to check that before we get started, okay, because I don't want to do all this and then your insurance, because I have this in kind of insurance for my kids, and sometimes they'll take it away and then not tell you, or they won't send you the letter. I hate that. But I'm going to go ahead and check that right now on my website, okay? Just let me know whenever you're finished with that, okay? One, 829 176. Okay. All right, your insurance is great. Okay. All right. I'm gonna put that aside. Whenever you're done with that, just set it right here, okay? And then we can get started. Excuse me, I need a drink of my coffee. We're just going to go over your medical history just to make sure that everything that you wrote down is what you actually meant. Because I don't want to do tests on you or anything like that, and you know what I mean. Okay, so your average weight is 142, okay, and you are 5'6", okay, and you have no known allergies. Great. And how's your health been recently? It's been okay. Okay. Do you have any concerns that you need me to check out or anything? You just have a mole. Oh, yep, I see it. Okay. I'll get that measured and everything, and feel around on it and make sure everything's okay. Because my mom had one, and she actually had to have it removed. Any recent illnesses? Like, did you have the flu or anything like that? No? Okay. Any heart or chest pain? No? Are you a smoker? You are? Okay. I'm not one of those doctors that tells you to quit. I mean, it's your choice if you want to smoke or not. Okay, so that. No bleeding tendencies. So if you cut, like paper cut, if you get a paper cut, do you bleed more than usual? No? Okay, that's great. Okay. Any asthma? No? Do you have asthma that runs in your family? Your brother? Okay. And is it just like a mild case, or does he have to have like an inhaler with him like 24/7? Just a mild, okay. All right, any liver disease or diabetes? No? Okay. Now we're going to get into the little shyer part of this portion. I know that you already answered it right here, but I have to make me feel better, I have to discuss this with you. Okay, so have you had any sexually transmitted diseases in the last 12 months? You did? Okay. And what was that? Chlamydia? Yeah, that's a pretty awful one. And how did you have that treated? Did you go to the hospital, or did you go to a free clinic, or you went to a free clinic? Okay. And did they give you the shot, or did they just give you that giant pill that you have to swallow? They gave you both? Okay. All right, I'm just gonna mark that down in your file, and later on, I will put all of this stuff into your file into my computer, okay? Okay, so, but you got that treated, right? Okay, great. All right, and have you had, let's turn this over. All right, how long ago did you have that? About 4 months ago? Okay. Okay, I am actually going to refer you to the gynecologist that is partnered with me. She is fantastic. She's very nice. She's, very skilled in her line of work. So I will give you a referral for that. I'm actually going to make a note for myself. Okay, and are you sexually active right now? Well, not right now, but, you know, recently. Okay. Is there any chance that you are pregnant? Maybe? Okay. Now, most places, they just have you pee on a stick, but I prefer to draw blood because that is a little bit more accurate. So we will be drawing blood. I know it's very scary. I'm very sorry about that. Okay, so blood draw. Okay. And how many partners have you been with in the last 12 months? 4? Okay. Oh no, sweetie, I've heard way worse. It's okay, 4 is not a big deal. Okay, so. Alright, now what I would like to do is I would like to just get like a general check of your eyes. If I see anything wrong with your eyes or anything like that, I will send you to a different doctor. I know it's so frustrating that there's so many doctors for so many different things. Why can't they just learn everything? Okay, so I'm going to check your eyes and then we're going to get your blood drawn. Okay, and that usually takes a couple days maybe. It just depends on how busy the lab is. So it'll just take a couple days. If you would like, you can take a pregnancy test later on, like after we're done here. And that'll just give you a peace of mind to see if you are pregnant or not. But like I said, I prefer to draw blood only because that's, you know, a little bit more accurate. It does take a little bit longer, but okay, so we're gonna go ahead and get started. My flashlight is actually broken, so I'm just going to look around your eyes, okay? I'm not gonna like look deep into your eyes, okay? And this is just a little magnifying glass. Okay. All right, can you look up for me? Just look up. There you go. Okay. And can you look down for me? Thank you. Okay. Your eyes seem pretty great. When was the last time you went to the eye doctor? A couple months ago? Okay. And they didn't have you get glasses or anything like that, or reading glasses? Nothing? Okay. That's great. Alright, so I'm going to sanitize my hands. We don't have a sink in here, but I washed my hands before I came in, so. Alright, and then you let that hair dry. It takes a minute with this stuff. Are you afraid of needles? Not really. That's good. I always have trouble trying to figure out which way is which on the gloves. And before I draw your blood, I'm actually going to check out that mole that you said that was on your face. sure that it's in reasonable lengths. It's not too big or anything. Okay. That actually looks really good, so there's nothing to worry about there. I'm going to check your ears really quick though. There's no tenderness in here on the outside of your ears, right? Okay. This one. I'm gonna take a peek inside, okay? My necklace in my shirt so it's not smacking you. Okay. Okay. And the other one, okay. Your ears do seem to have a little tiny bit of earwax built up in them. But that's okay, we can totally fix that. Not today though, because you're not here for an ear cleaning, are you? Okay, so I will also make a note of myself to send you to an ENT doctor. Oh, ear, nose, and throat. Okay. So before we leave, I'll give you referrals to both those doctors, okay? Okay. So, checked your ears, I checked your mole. Now it's time to draw blood. Now, oh, I'm sorry, I almost forgot. I have to check your throat. Okay, so this is just a tongue depressor, okay? I'm just gonna stick it in your mouth. I'm gonna have you open your mouth. Okay, and then I'm gonna push your tongue down so I can see the back of your throat, okay? Okay, so this shouldn't hurt or anything like that. If anything hurts, just let me know. Just go, Okay, okay. So, open wide, but very, very big so you can. Okay, cheek. Okay, the other side. Okay, that looks great. Oh, you don't have your tonsils anymore. Okay, when's the last time you've been to the dentist? About 6 months ago. Okay. They said everything was fine. Okay, great. Okay, so now we are going to draw some blood. Now I will first need to check your arm for any veins. Okay, there it is. Okay, I'm just gonna wrap this around your arm. Okay, and I just need you to make a fist, okay, and then just pump it for a minute. Okay, just keep doing that. Okay. Do you have Willie veins? I do too. Whenever I was pregnant with my son, I went into early labor and they had to do an emergency C-section. Well, with early veins and small veins, it took them at least least 10 or 15 minutes just to find a vein. Yeah, it was pretty awful. I got stuck like at least 4 times. It wasn't like that with my daughter. My daughter was, she was pretty quick. Well, the labor wasn't pretty quick. Okay. So, if you're scared of, well, you said you're not scared of needles, but still, it's probably not a good idea to watch. Okay, so, I just got the needle, okay, and my little vials. Alright, so I'm going to double check that vein. Okay, good. Alright, take a deep breath. Oh, gotta open up her Band-Aid. Pieces of gauze. Just to have it out and ready. I know you said that you weren't a big bleeder, but sometimes veins can bleed a lot. I was just teasing. I was getting you ready. Alright. So double checking, triple checking now. That vein. Okay, we're just going to wipe it down with alcohol. Alright, so you ready? Okay. 1, 2, 3. Good job. Alright, so I'm going to open up my little vial. Just get that in there. Okay. So we're going to let that fill up for a minute. I'm actually going to take 2 different samples. One is just to check for the pregnancy test, and then the other one is just to run it and check your iron and all that stuff, okay? Check your iron and make sure your blood count is okay, and just a standard test that we do with blood. Okay, so first bottle is nice and full. Okay. Get our second one going. Okay. Seems like enough. Alright. So now we got that. Alright, I'm going to take this gauze and I'm going to stick it right over where I just poked you. And then I'm going to pull the needle out. And then I'm going to need you to hold that there for a second, okay? Okay. Ready? 1, 2, 3. See? And there we are. Alright, we're going to get our Band-Aid. Alright, and I need you to hold that there for a second, okay? Alright, there's that. Okay, I'm just going to dispose of this stuff. Get rid of all my trash. I'm going to, oops. Alright, so this one is for the pregnancy test. And then this one is going to just be for, like I said, just regular blood test, just to check your blood, make sure everything's kosher. Alright, so I'm going to set all that aside. And then I'm going to write out your referral for your nose and throat doctor. Okay. Okay. Sorry. Alright. So I'm just going to write these on the same one because there's a perforated edge, so you can just split them up. Okay. It's kind of like a prescription pad, but not really. I'm going to go ahead and take my gloves off. Alright, now, the ear, nose, and throat doctor's name. His name is Dr. Bloom. Okay. And he actually has a fantastic nurse. She is probably going to be the one that is going to be taking care of you. The only time that he will come in is if, like, you need surgery or anything like that, okay? Alright, so Dr. Bloom, his first name is James Bloom, and they are in your hometown, okay? So you don't have to drive all the way back up here. So James Bloom, and then the nurse's name, her name is Jane Montgomery, okay? Alright, so you know where they're located at, okay? Okay. Alright, and then the gynecologist. And depending on the results of your pregnancy test, I will send those results to the gynecologist, okay? And I actually, I'm going to actually let you choose your gynecologist because that is actually a very important doctor to, I guess, create a bond with. Whenever I was pregnant with my kids, I was very picky about who I went to. But he did a fantastic job with both of them. So, but like I said, I will let you pick your gynecologist. I'll just write out a few that I know of that work in your hometown. Okay. So there's Dr. Brewster. There's Dr. I'm trying to think. Oh, there's Dr. Yep. Okay. Dr. Friedman. There's also Dr. McDaniel. She actually, they're also a gynecologist, baby doctors also. So, she actually specializes in premature babies. She was actually my son's doctor whenever he was born because, you know, he was born almost 2.5 months early. So she was actually a fantastic doctor. I'm not saying that if you are pregnant, it'll do that. I'm just saying that just for information in case anything like that happens. Okay, so there's that. Okay. referral for that, okay? Alright, so there's that. Now, everything looked okay. Well, I mean, health-wise, you are fantastic. I would like to see you back in at least 6 months, okay? Just to do another general checkup, just to make sure that everything is okay, all right? If you have any questions, just call me. If the spot that I drew blood on gets, you know, too sore or anything like that, but you shouldn't have any issues with it. Some people do, but everybody's different. Okay, so make sure you get a hold of those doctors. And if you do turn out to be pregnant, I can also give you a list of just general pediatricians, okay? And those would be in your area as well. Alright, so let me check something really quick just to see where I'm at in the next 6 months. Okay, what day works best for you? Thursday? Okay. Alright. I will see you in about 6 months, okay? You have a great day and drive safe down there because, like I said, that construction is just insane, okay? Alright, bye.